Hello, everyone, and welcome to TMA's webinar of the day. It has been highly anticipated with 151 people registering uh, for Finding Peace, Easing Anxiety with CBT, featuring the insightful and esteemed Dr. Sanchita Sharma. I am Rachel Bromley, Senior Manager of Patient Education, Support, and Advocacy here at the Myositis Association. TMA was founded in 1993, and our mission is to improve the lives of persons affected by myositis, fund innovative research, and increase myositis awareness and advocacy. We are so glad you could join us today for this incredibly important conversation on managing anxiety using cognitive behavioral therapy, or CBT. Whether you're personally navigating the challenges of anxiety or supporting someone who is, this session will provide you with valuable tools and strategies to find relief and restore balance in your life. A little bit about Dr. Sharma. She is a licensed clinical psychologist with years of experience helping individuals cope with anxiety, stress, and a wide range of mental health challenges. With her expertise in CBT, Dr. Sharma has empowered countless individuals to transform their thoughts and behaviors, leading to lasting emotional well-being. Before we begin, a quick reminder, you can submit your questions through the Q&A box. If you pre-submitted a question, it's already loaded into the Q&A, and so you don't need to type it again. We'll address as many as possible during the Q&A at the end of the presentation. Also, we would love to hear, where are you tuning in from? So I am broadcasting from the TMA office, Columbia, Maryland, and please put in the chat where you are tuning in from. We'd love to know. All right, now without further ado, please join me in welcoming Dr. Sanchita Sharma.
Hi, everybody. Thank you, Rachel, for that lovely, lovely introduction. I am so excited to be here and be able to chat with everyone today. And of course, anxiety is a really, really big topic. And I hope I can do it justice and try to bring as much knowledge as possible to this conversation. And one thing I just want to start with saying is, today is just the start of having this conversation. And, this is something, and dealing with anxiety is just an ongoing, lifelong process. And I just hope that I can give even just one tool that someone can take away from today, that something can be helpful for them for their day-to-day. So what I'm going to do is I'm going to share my presentation and we will get started. Okay, Rachel already went through this, and I just wanted to
Okay, I
Yeah.
will, hold on one moment. Let me put my video back on. I'm just going to read before we get started. TMA does not give medical advice, and we ask every speaker to disclose any potential conflicts at the start of their presentation. This webinar is being recorded and will be available on TMA's YouTube channel on the 1st of next month. Please put any questions you have in the Q&A box. There is an anonymous function. I did say earlier, pre-submitted questions have already been loaded into the Q&A. Feel free to use the chat to let us know where you're joining from and interact with others, but any questions there may be missed. So go ahead.
Thank you. Okay, as Rachel said earlier, my name is Dr. Sanchita Sharma. She already gave you a great background of what I've done. I've been working in hospital settings for a very long time, and I have worked with many children, families, individuals across the lifespan, helping them manage dealing with their day-to-day when it comes to chronic illness and chronic pain and fatigue. Currently, I used to work with Children's National in Washington, D.C., but now I'm working at Maryland CBT Center, which is a private practice where I specialize. I work with patients who are dealing with anxiety disorders, depression, and trauma. So I really enjoy doing this work. It's very hard work, but it's also, I find it's really rewarding, especially for the patients that I work with. So I just want to start off with a little poll, first of all, just asking you, like, how do you think myositis impacts your mental health? Is it impact on your family and friends? Is that your biggest worry? Is it unpredictability of the future? Is it day to day, or is it all of the above? Oh, and if you can also just type this in the chat if you like, or Q&A about these things, about the responses.
Yeah, I added an other just in case there was
Yeah.
something else they wanted to let us know, affects their mental health.
Great.
Okay, we have about 85% of participants have done. So I'm going to go ahead and share the results.
Okay. No surprise that all of the above is usually the one that wins out. Rachel, can you tell me what's the other, if you can see
Fear of falling.
it? Okay.
And then also someone struggles with having multiple diagnoses. So yeah, that is adding a lot. Someone else talks about self-esteem
Yeah.
and anxiety about getting sick. These are all really good contributions to the chat. So thank you for sharing.
Yeah, this is so helpful for me to know, right? Like all the things, and that's the thing with, as I was mentioning earlier, anxiety is such a big topic. It encompasses so many things. And that's why it's like really helpful to me to know like what everybody's experience is with it. And not everybody's experience in myositis is going to be the same, or their anxiety is going to be the same, right? And the other second response, I wanted to just make sure unpredictability of the future, which is a very, very common anxiety response, comes up when I work with someone who has chronic illness, because as we'll talk about this later, when we get a diagnosis, it's a very complex thing. Sometimes diagnosis brings this sense of relief. Hey, now I know what's been happening. But then it also brings this sense of anxiety and uncertainty and grief about what is there to come, right? And so we'll get into about this in a little bit. So we're here to talk about anxiety. So what is anxiety, right? So anxiety is this unpredictable, well, it's not unpredictable, it can be unpredictable, but is this future worry state that we can have, right? That where we worry about what something bad is going to happen, and basically then our body reacts to it accordingly. So think about it as like the fight or flight response that we constantly hear about. So the best example of anxiety that I can give someone is that, think about it, if you're driving and you've been in a near miss accident. It's the feeling that happens very fast, but also very slow motion at the same time, right? Like that's the thing with anxiety. Like it can happen within seconds, where your body just tenses up, prepares for that impact, or prepares for you to like swerve off, or prepare, and your pupils dilate, and all these things happen in your body. So your brain can make that big decision. When I ask people to describe anxiety to me, a lot of times people describe that in emotions like, hey, I'm constantly worried, I'm constantly nervous, I feel this dread that something bad's gonna happen. And they describe their thoughts as they're racing. I keep thinking about the same thing over and over again. I think about the worst case scenarios. I think about, I just keep getting stuck in this spiral. They feel like anxiety to me feels like I have these sweaty palms. I feel dizzy. I have a stomach pain, I'm headache, and all of these things. And so this is when I get in treatment, I ask about like, hey, what behaviors are you doing when you feel anxiety? So a lot of times is we want to address what are some things you're avoiding because of the anxiety, which is maintaining the anxiety cycle. And what are some things we want to do so you can adjust to the anxiety cycle? So anxiety serves a purpose for all of us. Anxious feelings, while uncomfortable, tells us there's something in the future and that's wrong, and hence motivates us to act, right? Going back to that near miss accident example, right? We need anxiety in those moments, right? Like think of anxiety as set of alarm bells in case there's a fire, or think of it like alarm system in our house, like in case there's an intruder, in case something happens, like we want that alarm to go off. However, for people who have anxiety because of a chronic illness, what happens is that their anxiety just never goes back down. Like think about it, when you get in that near miss accident and you avoid it, and you, after a while, after a few minutes, you're like, whoo, and eventually things start coming back down, right? But when chronic illness, that those alarm bells just never shut off, right? They're just there constantly in the background, making you think something bad is going to happen. And what that happens, when that starts happening, people try to avoid situations that can trigger or worsen their anxiety. And they start having an out of proportion anxiety response to the situation, which may not warrant it. And this hinders their ability to function. So anxiety and chronic illness. So someone who has a chronic pain, chronic illness condition, they're at higher risk of developing anxiety, which makes sense, right? Because living with chronic illness can be unpredictable and disruptive. And chronic pain in particular can heighten anxiety levels, as brain's inability to regulate pain can increase both pain and anxiety. And a lot of times in case of various emotion, physical sensations, what they have are often based on reality of their symptoms. So let me give an example of that. So when I work with someone who has an anxiety disorder, who doesn't necessarily have a chronic illness, what we try to help them do is recognize like that their anxiety response doesn't match what the situation at hand is. Like, for example, if somebody has presentation anxiety, right? Like they have to present in front of other people and they're feeling really, really anxious. It's okay if they're feeling anxious, but what we help them try to understand that nothing bad is happening, right? They're not going to die in that situation. This is not a harmful or life-threatening situation. So the anxiety response is not matching up. Versus for someone who has a chronic illness, oftentimes their reality is based on their symptoms, right? For example, that if you've had a heart attack, if you start having like chest pain, which may be anxiety related, it also could be like related to your heart, right? So it makes sense. There's some reality in those symptoms. If you have a lung condition, you have a shortness of breath, and if you're feeling, it can sometimes get conflated with anxiety, right? So, and sometimes if you have an illness that is terminal, feelings of like that I may die is a real possibility. So it makes sense why anxiety is so much higher when you have a chronic illness. And those with chronic conditions, something like just like myositis, you must cope with the persistence and unpredictability of the illness, right? And so, of course, dealing with this constantly leaves you feeling anxious and worried. And this constantly worry of are my symptoms gonna when are they gonna come back? Are they gonna come? And if they do come back, is it gonna be worse when they come back? And what happens is that sometimes because of that, we start focusing on any body sensations or changes, and we believe that to be something that's indicative of like a serious illness. So it's something that will affect us emotionally, cognitively, behaviorally, and just from all and whatever that we can sense. So what do we do about it? So here's a quote that I really like to start off some of my sessions with. I like to talk about nothing diminishes anxiety faster than action. So what does that even mean? What actions do we take here? So first things I talk about is active coping versus passive coping. So what we do know is active coping strategies when you have a chronic illness or in general, are the most helpful in managing anything. Like they are associated with better outcomes. And this includes like regular exercise, maintaining daily activities, ignoring sensations when appropriate. So for example, I work with someone who has a phobia of vomiting. And so one of the things that we work on is her not paying attention to just day-to-day body sensations. If she experiences a stomach discomfort, she automatically assumes she's going to be nauseous and throw up and just goes down the spiral. So we work on accepting those sensations. Other things we work on is like other things of active coping helps with this developing adaptive thinking, which is really reducing some of those unhelpful thinking behaviors, forming those fear avoidance beliefs, like, hey, I am too scared to do this, believing that, if something bad is going to happen, so avoiding the activity, and then really increasing what we call those illness, pain, self-efficacy beliefs, and pairing that with like actively building in relaxation exercise and mindful meditation for your day-to-day. What we know is not helpful is passive coping strategies, which do not involve taking action in response to the pain. As we know, they are just associated with poor outcomes. These examples can include just venting emotions, talking about the same thing over and over again, or increasing doctor visits, basically seeking someone else who can do something to make the pain go away, or illness go away, and just avoiding activity because you're afraid if you do this activity, then that means you're gonna be tired or you're gonna be in pain. And I do want to say this with caveat, right? Like that with chronic illness, this is a challenge. Of course, this is a very, very difficult process, right? If you're living with something like this. So it makes sense when there are going to be times you're going to vent about this. It makes sense when you're going to want to go to someone to make this pain go away. You think about with myositis, like how many medical visits are involved in part of this process. So I do want to give that caveat. That doesn't mean you're doing anything wrong. It just means we just don't want this to be the only tools that are in your toolbox, right? We want to be able to start adding more things that can be more helpful to it. So we come from a CBT. I am trained in cognitive behavioral therapy approach. And so what CBT does in treating chronic pain and chronic illness is what it says is, well, let me tell you a little bit about cognitive behavioral therapy. It is one of the most widely researched time-limited psychotherapeutic approach that has been shown to be effective across a number of mental and behavioral conditions. It involves a structured approach that focuses on the relationships among cognitions or our thoughts, emotions or our feelings, and behaviors. I would like to once again start with when I first started working with patients with CBT, the first thing they tell me is, I want to feel better. I want this anxiety to go away. I just don't want to deal with these negative emotions. And I tell them I want the same for them. But however, feeling better is a process. And I tell them usually feelings get better after we have worked on other things. Main reason for that is because feelings are really subjective, right? That the fear that I feel is not the same fear somebody else may feel, right? And or the level that I feel about the same situation is different than somebody else may feel. So feelings are just really hard to describe. And if that's the first thing you start working on, that's when people start feeling that sense of like defeatedness. So what I try to work on is shifting towards working on noticing what your behaviors are and what your thoughts are. Because what CBT says is what we're going to do is affects how we're going to think and feel. What we think affects how we feel and act. So let's shift on what are some unhelpful behaviors you may be doing in day to day when you feel anxious, when you feel stressed. Then we talk about what are some thoughts that you can do, what are your day to day, because thoughts are much more easy to describe. You can say, I thought this person was going to be mean to me, right? I thought this person's always going to be mean to me. So I can understand the full context of where you're going. And same thing with behaviors, right? If somebody's like, last time I went to a grocery store, I had a panic attack there, and I'm not going to that grocery store anymore because I'm scared of having a panic attack there. So that's something that I can work with, and then we work on breaking that down, right? So, and part of then when I work with someone, especially with take a CBT approach in helping someone with chronic illness, is we take an approach in really helping them shift their unhelpful thinking, shifting what any unhelpful behaviors they'd be doing. For example, helping them pace their activity levels, like really helping them become more active, but with their confines, like really helping them avoid the boom or bust cycle. Like, for example, when you have a really good day, you end up doing so many things, and then you basically pay the price for it the next day. And then you respond by not doing anything because you're scared of feeling that pain come back. So we really work on how to pace ourselves, how to take those breaks, and how to still maintain a certain activity level. Oh, okay. So yeah, I think, sorry, something happened with my presentation. Hold on, give me one thing. I'm gonna come back to this slide. Okay, sorry. It just skipped like 4 slides. So let's start with negative cognitions and unhelpful thoughts. So the role of cognition and thoughts is a really important area of self-management in just chronic illness. As illness becomes more chronic, it can just lead to a pattern of negative thinking and overall negative worldview. And in turn, negative thinking affect all sorts of psychological and physiological processes, including the perception of pain. The frequency and intensity of these negative thoughts can become so automatic, a person may not be aware of how often they're happening, as well as the debilitating impact they can have on coping with pain and overall quality of life. And why I really want to work, I really work on this is because a lot of times my patients I work with, they are so focused on the situation. They're like, if they feel like it's the situation, it's my diagnosis, it's, being here, this is what's causing my anxiety. So I tell them in any given situation, we can do, well, technically four things. We can change the situation, we can get out of the situation, or we can change how we think about the situation. And last one is do nothing. Um, so I think of it as work. If you work with someone with a very difficult boss, like what are our options? And if the difficult boss is giving you a lot of anxiety, a lot of stress, you can change the situation by getting a different job. Or you can get out of the situation by just avoiding, like another way of just getting another different job, or trying to work less and less with your boss. Or you can shift the way how you can think about the situation. If leaving a job is not an option, right? If you don't have anything else, if you don't have other options, you still have to be in the situation, because that situation is not going to shift, right? Situation is something that's in some ways, many ways fixed, right? Just like a diagnosis, right? Diagnosis can't change, but what we can try to do is shift what we can do about it. And one way is by looking at some of our negative thoughts. So a lot of times people who have a lot of they engage in what we call cognitive errors, thinking errors, or like having a lot of these irrational beliefs. So a lot of black and white thinking, right? That if I'm in pain, that must mean my life is ruined, right? A lot of emotional reasoning. If I feel this way, then this must be the truth. Or mind reading, that my family and friends are sick of me, they don't want to be around me. Should statements, I should be able to do this. I shouldn't be doing this, or somebody shouldn't be doing this to me. A lot of fortune telling, right? Like if I'm in pain today, that must mean this is permanent. I am going to be feeling like this from 3 days from now on, or for the rest of the month. Or labeling, like calling yourself, I'm damaged. I am, all like just using a lot of harsh words with yourselves. So this is just an example of a lot of like what we call like irrational beliefs someone has. And one of the most common ones people do is catastrophizing, which means thinking of the worst case scenario. So, and catastrophizing or catastrophic thinking research has showed us it has one of the worst outcomes for someone who has, who lives with a chronic illness. Because what it does is it messes with the way how you appraise a situation instead of being more reality based. So what do we do about it? So I'm going to go into this a little bit, more in detail. So first, we want to think about how do we challenge that thought with evidence, like being a lawyer and arguing the case. Like, hey, is this actually true? Is it really as bad as I am making it to be? Then learning to face the fear, of course, with support, which is like setting up behavioral goals. A lot of times when someone has a lot of anxiety, we set up with what we call like a hierarchy. So where we rank their fears and we work them through in a systematic way from something that's a level 3 fear to level 4 to level 6, level 8, 7 to facing it that way. Because what we don't want is if you're really scared of something and we make you face your worst case scenario, because what that's going to do is like overload your brain and flood you, and you're not going to have any learning happen to see that, hey, that situation wasn't dangerous. We come up with personalized effective coping statements or reliable go-to phrases to help you get through stressful moments. We work on compiling past successes and accomplishments and focusing on what has been achieved versus what hasn't. And we'll go into this later too, practicing thought diffusion, which says I'm having the thought. So kind of creating that separation between you and the thought. Instead of saying I'm anxious, being able to say that I'm having a thought about being anxious. So being able to take a step back instead of readily identifying with the thought. So let's go through an example. So example would be a situation, you get a diagnosis of a chronic illness. Automatic negative thoughts, maybe I'm going to be dealing with this for the rest of my life. My friends and family wouldn't want to be around me anymore. So when you think that to yourself, Most people just describe in next emotion, their emotion feeling like anxious or feeling a sense of despair, feeling sadness. So when you would do this in treatment, I would help you work through what are some thinking errors? Hey, what are some irrational beliefs you're doing here? Do you think you may be thinking the worst case scenario? Maybe you think you're doing some mind reading here. And so we would then come up with, identify what happened, catch those thoughts, and then we would come up with a hopefully a rational response together. Like being able to say, yes, I will have to learn to cope with my illness, but I can do it. I have no evidence that people won't want to be around me. Many people have medical conditions and they still live a meaningful life. So this is just a bare bones example what it could look like. So now I'm back to the slide that I wanted to be in. So think of it this way, let's practice ABCD. So if you're at home, and of course, since I can't chat with you guys, see if you walk through this example with me, okay? So think of an activating event, a trigger, just something that recently happened that caused you to feel stressed out, right? Like, which means like it could be it doesn't have to be necessarily myositis related. It could be just something simple as like your kid was really rude to you, or you like your boss was hard on you, or something along those lines, right? So think about like a trigger that just happened that caused you stress. I'm going to give you just a couple minutes just to think about it. Now, as you go over that stressful situation, now think about it. As soon as stressful situation happened, what was your negative self-talk? When you started feeling anxious, right? What were you saying to yourself? What was a belief that you were clinging on to? And what interpretation were you making of the event? And now ask yourself, what was the consequence of those negative beliefs? Like, what were you feeling, right? What was your behavior as a result of those beliefs? Were you feeling more anxious? Were you feeling sad? Were you feeling frustrated? Like, what were you feeling when you were thinking those negative thoughts to yourself? And what a behavior would you have been doing because of those beliefs? If you were feeling anxious about something, did you just decide then as a result, since I'm feeling anxious, I'm just not going to do this activity. I'm just going to stay at home. I'm going to avoid this. Did you find yourself just getting short or irritable with other people? So it can just look a wide range. So what I would do next is we would walk through an example like this in session with someone, and I would have them sit down, like, let's dispute this. Let's come up with a counter thought to what your belief system was, right? Being able to ask yourself what realistic and grounding statement that you can use instead. Is there an alternative way of thinking here? Like, what is a statement that I can use? What can help me think about this in a different way? What is a statement that I can use to help remind me to practice my self-coping or self-care strategies? We work on asking yourself, what evidence do you have for this situation? And what evidence that you don't? What is a balanced way of looking at this? And I like to tell people is like the goal of this is not always to have positive thoughts. The goal is this to have finding that balance, finding what is the middle place, something that's more realistic and something that's adaptive. So some coping thoughts I have come up with, patients have shared with me, they say to themselves is like, this situation won't last forever. This pain flare, this fatigue flare is temporary, it shall pass. My feelings are making me uncomfortable right now, but I can accept them. I can still be anxious and still deal with the situation. Pain does not have to define me. I'm much more than my pain condition. My life has meaning. And once again, this is not to get rid of anxiety. This is not to get rid of those negative emotions. It's not gonna make it go away like a snap of fingers. But the goal is, once again, to start shifting the way that you are thinking, perceiving the situation, or how you're going to do about it, so it can start shifting away how you're eventually going to feel about this. So think of it this way. One of the things I really like to use an example with kids is like roller coaster, right? Think about people who love roller coasters. Think about people who don't like roller coasters, right? The same situation, nothing is changing about the roller coaster, but it's how people are perceiving the same situation is affecting what they're doing about it and how they feel about it, right? Same people, there are some people who see the roller coaster, they think, oh gosh, that seems so awesome, so exciting. I want to sit in the front seat, right? I want to feel all the adrenaline, right? Um, they will go there, they'll stand first in line and all of these things. Versus someone who sees the same roller coaster, they see that as a death trap. They're like, I don't like how it makes me feel. I get really anxious on there. And guess what they'll do? They'll avoid it, they won't get on it. And this is where I would try to bring out, like, if we want to change something about it, if we want to help you get past this fear and not avoid this thing, what can we do differently here? Right? How can we start thinking about the same situation in a different way? And doesn't mean it will make you love roller coasters, but can we help you find a way to help you see them in a less scary way? So caveat here with CBT is, when we start having those negative thoughts, the goal would be, let's start catching them, right? Being able to say, hey, and this is the hardest step, to be honest, because a lot of those negative thoughts become so automatic. So this one way we work on this is like really tracking those negative thoughts, right? I encourage people to have conversations out loud with themselves. Like, that's completely okay and that's completely allowed. Um, Journaling, tracking, right? Writing them down, like helping noticing. So this way you start seeing those patterns and you start getting more awareness, insight as to what your triggers are and what the themes of your negative thought patterns are. And then we work on checking them. Hey, is this actually true? Was the situation, is it what really is, or did my anxiety make it bigger than it needs to be? And then we work on changing it. So I'm going to ask you just take a couple minutes to think of a recent example in where you engage in just healthy thinking, right? And so think about, what did you do and what was your self-talk to do the healthy behavior? So just think about your thinking process. And once again, I know that I'm not interacting with you, but I want you to be able to see what the answers are and kind of start breaking that down for yourself. And while you're thinking about this, and I want you to think of a recent example in which you engaged in what we call unhelpful thinking, right? When you had a stressor and you automatically jump either to the worst case scenario, or you did something which just not helpful, didn't make the situation better or didn't make you feel better. So think about, what did you do? Like, how did you respond to the situation? And what was your self-talk, negative self-talk that led you to do that unhealthy or unhelpful response? This is just an example of some things that I would do in session, like to really help someone break their thought process down. Like we'll look at the tracking sheets of the negative thoughts and we'll go over the triggers and really help them break it down. Something I also recommend to someone is if you had a stressful situation and once the stressful situation's over, just sit down to yourself for 5 minutes and reflect upon it. Like, what happened there? How did I respond? What did I do? What was I thinking? And just so and that can be really helpful data for what you can do about a situation similarly for the next time. One question I really get for someone from when I'm working with someone with chronic illness is, what do you do with thoughts that are true but unhelpful, right? So if you have a chronic illness or a terminal illness, when symptoms are going to continue to get worse, how do you say to yourself, right, hey, like there's truth to those thoughts. Those thoughts are not irrational, right? But at the same time, they're not helpful. So something I really work towards is what we call acceptance versus changing, right? Means like the focus isn't on changing anxiety-filled emotions, but rather learning to withstand, accept them, and make positive choices in spite of them. Practicing getting unstuck from those emotions so you can pursue what we call a more value-consistent actions. Acknowledging the negative emotions that you're experiencing and trying not to dwell on them. And recognizing almost everything to us, every valued activity has some distress associated with it. And maybe we need to be willing to have distress in order to live a life that matters, and not making pain, illness, fatigue, our diagnosis, our identity. Once again, I know this is easier said than done. Part of acceptance is not blind acceptance, saying, well, I accept that I have this illness that's never going to get better, so what's the point of doing anything? Acceptance means accepting reality and what are the confines of it and what are the limitations that you have with that, right? Accepting that there are going to be days when you're going to have pain, and those are days you're not going to be able to accomplish what you wanted to accomplish. Accepting there's sometimes anxiety is going to getting in the way of things, and that doesn't make you a flawed person. That doesn't mean that there's something really, really wrong. Or sometimes, for a lot of times, accepting, like one thing that we talk about with people with chronic illnesses, conditions, like accepting this perceptual constant fear, constant worry that people in their lives are going to be sick of them. They're going to have to make accommodations around them, and they're going to have to change their behaviors. And that's a really hard part of accepting, right? Yes, it may shift things people for you around you, but that's also accepting that that's okay, that they still love you and they still are going to be here to support you. And how do you do that? How do you, instead of stop fighting that reality, not constantly asking it questions, how do you just lean in with it? So I'm going to play a YouTube video just to go over that, to just, just explains this concept a little bit better than I can. So, oh, oops. I'm gonna stop sharing and play this video.
The great challenges.
Loading. Oh.
Enough about a subject to think you're right.
Rachel, can you confirm with me that you can hear? So everyone, just make sure everyone can hear.
I am able to hear.
Okay.
But not enough about the subject to know it.
Hi, my name's Shamash, and this is the metaphor of the tug of war. So imagine you're having a tug of war with a monster. And this monster represents your difficult thoughts, your difficult emotions, difficult experiences and urges. So it's you on this side and your monster, your challenge is on this side, and you're having this tug of war. And the more you pull on this side to try and pull the monster across so that you can win this tug of war, the more this monster pulls back again. And the tricky thing is in the middle of this tug of war right here is a big hole. And if you lose this tug of war, you're worried you're going to fall deep, deep, deep down into this big, deep hole with scary stuff at the bottom of it. You don't know what, in fact. So what do? You pull harder, but the harder you pull, the harder it pulls back, and you're in this tug of war that just seems to keep going and going. And the only kind of solution that you can think of is to try harder. So you try harder and harder and harder, but there's always this struggle going on between you and your monster, whatever your monster represents. So what's the solution? Well, if we use our problem-solving mind, the solution seems to be just pull harder and harder and harder. But if you take a little bit of a step back and you think of it from a bit of a different perspective, a bigger picture, there is, in fact, another solution. And that solution is to drop the rope. If you drop the rope, suddenly the tug of war is over. You're not involved in fighting, in avoiding, in challenging, in trying to win this battle. In fact, in some ways, that battle is ended. But it can feel really counterintuitive, especially when you're in the middle of this tug of war and you think you need to win. So you need to see it in a different perspective. And that's what allowing, acceptance, letting things be means for our tricky emotions, for our difficult thoughts, difficult experiences, tricky urges, rather than trying to fight them and win. Imagine dropping the rope, and this is a great metaphor that you can remember to keep in mind whenever you're kind of struggling with the difficulty and you're using your normal, habitual, automatic pilot approach, which is to try and win this war. But what about you remember, drop the rope, and you can just remember those 3 words, drop the rope. You can even write it down, remember this image, do your own imagery, maybe see other videos with this concept of just letting go, dropping the rope, and see if you can start cultivating that skill within yourself. At the beginning, you may keep doing that, and I think we all do actually, but the very fact of even trying to release that grip a bit, or just experimenting for a second to let it go and hold it again, is a great practice. It's a great skill that you can develop. So that's a metaphor of dropping the rope. It's a great way to start cultivating more acceptance, allowing, letting things be, which is a radically different approach that a lot of research has found works and is successful in dealing with difficult emotions and thoughts. Thanks a lot for watching. If you're interested in more stuff like this, check out the links below.
I thought that does a really nice job kind of getting into what acceptance is about. I'm going to go back to our presentation. So one thing I also work through with acceptance is doing what we call cognitive diffusion, as I was mentioning earlier. It involves shifting from trying to change certain thoughts that are considered bad to learning to view thoughts just as a thought, no more and no less, right? It involves distancing, disconnecting, or viewing thoughts and feelings for what they are, just streams of words, passing sensations, not what they say they are, dangers or facts. Just stepping back, observing them, and noting what is happening without judging what is happening. Just process of diffusing from thoughts and learning to accepting them without struggle, so that a person can engage with life with more consciously and intentionally. Okay, so to just for the sake of time, so I want to make sure I have enough time for questions. What I would like to do is just leave this for everyone. It's a mindfulness video, and it's about being more in the present moment. This is something that I work with people who are anxious all the time, because a lot of times when you think about when you're anxious and stressed, we're so caught up in the thoughts, in the future, what is going to happen in the future or in the past, that we forget to live in the present. And the goal of mindfulness is to allow yourself that psychological flexibility instead of the rigid rules that anxiety creates for you. So
Dr. Sharma, we
yeah,
are able to go over if you are able to make sure. I still agree. Let's go ahead and just give them the link. But can you do that real quickly? Because I'm unable to copy it from your screen. But if you could put it in the chat,
yeah,
so
yeah,
everyone can have it right now, that would be great.
yeah, that's not a problem. I can do that. Okay, so I'm gonna go ahead and stop share and I'm gonna put in the chat. And if you want to just start getting with the questions, if that's okay.
Yeah, there. So this is your last slide.
Yes,
Okay, great. Yes.
I wanted to end on a high note.
Okay, so as soon as I see that in the chat, then I will start the Q&A. So take your time.
Okay.
Great. All right. We have several people. Let me come off and so people can see me. And then we will. Okay, here we are. Yes, someone said in the chat, mindfulness videos are truly amazing and really help with my mindset. And I'd also encourage anybody new to this to look specifically for breathing,
Yeah.
box breathing, whatever breathing techniques you can come across. You almost can't go wrong with them as far as I'm concerned. Any deep breathing exercise is nice. And John Moss said this is the best one yet with all caps. He sent that to me, not everybody. And if you could let me know, you mean webinar wise or that particular video? But I'm happy either way that John's happy, and I hope other people are.
Yeah.
So let's get to these questions here. How can you tell if an anxiety attack is not actually a heart attack?
Yeah, that's a really easy question. Not easy. That's a really common question that I often get because panic attack can feel like a heart attack, and research tells us like so many visits to ER are panic attacks related because people think they're having a heart attack. One of the things is the difference between heart attack and panic attack is that if you're having a heart attack, it's not going to get better, right? Those symptoms are going to stay there versus panic attack, even though it feels like a heart attack, it's gonna eventually those symptoms do come down. And another ones, it could be like with panic attacks, a lot of people just not feel just physical sensation. They also have what we call like cognitive sensations, right? Like, oh, this is like, they feel like, okay, this is what's going to happen. The people describe it as like having just a derealization that they feel like they're separating from their body. Versus when people are having a heart attack, a lot of their pain starts off as chest pain. And it's usually sometimes there for like hours on and days. Usually panic attacks don't last that long.
Okay. I want to specifically address one of the fears that people with inclusion body myositis have, and that is the fear of falling. Their body can give out on them at any time. So it's very nerve-wracking. One day it's fine, the next moment it's not. Several of them have a series of falls. I do know one person with IBM that told me he decided that everywhere he went, he was going to wear a biker's safety helmet. And he didn't care how crazy he looked. Everywhere, if he was going to go to the post office, he wore that helmet, and he actually did have a fall, and it cracked that helmet. And so he was so grateful for doing that. But I wanted you to maybe address how people can handle that fear because they don't want to stop living their lives because of the fear.
Yeah, absolutely. And I think part of, managing fear, and I think going back to this, fear is very real, right? This is not like, oh, I'm going to fall because I'm doing this activity, right? That kind of thing. This is a real fear that you can fall and you can hurt yourself. And I think it goes back to like part of you know your body the best, right? And part of it is recognizing and recognizing that how do you face this fear on day-to-day basis? And I think somebody had also mentioned a lot of times, like when you don't have accessibility, what are some like safety precautions that you can take in case the falling happens, right? Versus not being able to not doing anything, right? Because that's not going to help with the falling either, right? Not doing something is not going to prevent the falling from happen, right? That what we want to do is prepare and as much as possible. It's the same thing. I work with someone who has allergies, right? That if it's a real fear when you go to like restaurants and they don't take, like if they don't take precaution, like, you know, what do you need to do that you can die from that, right? So I said the allergy part is not changing. And so that's something that we like talk about, like what are some safety precautions that you can take to, so you can be like, this is what's in my control. And that's what I can do to prevent if this situation happens, and versus not doing anything.
Someone asked, is it common for those diagnosed with IBM to suffer from anxiety? Dr. Sharma is a CBT expert and not a myositis expert, but I do feel that although we don't have data on IBM and anxiety specifically, there may be data out there on chronic illness and anxiety, but I'll let Dr. Sharma talk about how it's just common for anybody, regardless of the population.
Exactly. Anxiety is one of the most commonly diagnosed conditions, whether you have a chronic illness or not, right? It is so attached to us. It makes sense because it's part of the emotion that we have, right? The fight or flight that's so ingrained in us as humans. And so in reality, like anyone can have an anxiety disorder. It's very common, but especially if you have something like IBM and chronic illness, as I mentioned in a presentation earlier, it makes sense why you're gonna have anxiety. Like in some ways, you need to have some anxiety to be able to be more prepared for the realistic aspects of the dangers that can happen, right?
Someone asked, is anxiety a symptom of the disease or is it brought on by worry?
I would say it's both. So anxiety can be a disease and a symptom, both, right? So that's why what we call like an anxiety disorder. So I think of it as a symptom when it's a symptom of worry, like when it's a particular stressful situation, right? Like, for example, with kids, like, you know, when they're studying for a test, it makes sense why they're stressed, right? Why they're worried about their test, that kind of thing. Versus, but if you have that worry chronically, all the time, then at that point it becomes a disorder or disease, right? Versus it's a symptom when it's able to pass.
Someone wants more info on fighting depression. I know this is a webinar on anxiety, and we definitely need to do a webinar on depression, but do you have a few comments on that?
Sure. So CBT uses very similar strategies for depression as well, right? Part of is like changing a lot of those negative thoughts that depression brings, like being able to identify what's happening and being able to start shifting what we call like taking those behavioral activation, getting more involved. Part of what happens with CBT, I'm sorry, with depression and anxiety is that it tricks our brain into thinking that we're not able to handle the stressor. It tells you these constant negative thoughts and lies, right? It says that you're a loser, you're a failure. If you do this, something bad's going to happen, right? It says it so much that you end up believing that as the truth. And that's what the goal of this is to really do some behavioral experiments to find out, hey, actually, I can do this. This was easier. This was a little bit better than I thought, right? And so we start shifting those thought patterns, and the same thing we do for depression, right? Really helping you getting back into, you know, believing in yourself. I know somebody had mentioned like self-esteem, like I think in the beginning, right? And that's kind of what we work towards is like beginning to like start having that confidence in yourself, right? Like shifting those thought patterns that are so ingrained in you because of depression and anxiety.
Linda, my colleague, put in the chat a link to finding your support and or affinity group. Mutual support can lessen anxiety, and you can also explore these themes. Okay, the next question that I wanted to talk about, someone asked about best anxiety meds. Now, I know you are not a medical doctor, but I did want you to maybe share some insights on that and also on the psychology behind actually accepting that you might need meds and being okay with that.
Yeah, Rachel, thank you. That's actually a really great question. I'm not a psychiatrist, so I don't prescribe medications, but I work with plenty of patients who are on medications and also who I encourage to get on medications. I tell people a lot of times medications are really dependent on what is the severity of what the disorder is, right? If you have mild anxiety, then maybe you may not need medication. But if your symptoms are in moderate and severe range, we need to talk about this, because what medication can do is it can really help with the physical symptoms, so you can engage in treatment better, right? So you can learn those strategies. Like, so think about it, like if you're constantly having panic attacks, how are you going to be able to learn to do skills, right? That if your high anxiety is constantly here. So medication can really help bring this down. What most people tell me is like they were really afraid of taking medications of the side effects, but once they do, they feel like, why did I wait so long? Because they truly can feel like their thoughts can clear up and that their functioning just improves and they can actually do the skills that they are learning in therapy, and they can see that. As regards to best medications, once again, I am not the best person to answer, but one thing, psychiatrists would be the best, or a primary care physician, someone would be the best person to talk with this, but most people are described what we call antidepressants or anti-anxiolytics. So this is things like Prozac, Zoloft, Lexapro, and there are all these different kinds, and a lot of this is determined by your doctor about what's the best fit. Sometimes if your family for example, like a family member has tried like a medication and they're a good response, so that could be a medication doctor might want to try, since genetically you may respond to it better, right? So, or they may talk about certain side effects you may not be able to tolerate, so they can tell you, hey, you may not want to try Prozac because it can lead to this cause X, Y, and Z symptom, that kind of thing. So that's one of the things I think this is a really important conversation for you to have with a provider who can prescribe them. So you can go through all your concerns about it and they can go over all of that. And then another thing they would talk about is dosage, right? Because everyone responds to a different dosage, right? The goal would be for you to start at a smaller dosage, help you adjust and increase until you start notice and you feel like you are able to, it's like you're at a good dose for you.
Thank you. And I'm not a medical doctor either, but when I worked at National Alliance on Mental Illness, they talked about how at that time, maybe it's different now, that it could take up to 2 years to find the right actual medicine and then also the right dosage. So it's kind of its own journey. Which is unfortunate. I do want to say we constantly had issues with people taking the meds and then they start to feel better because that's the meds working, but then they think, oh, I feel better, I don't need to take the meds, and they'll stop, and it's just this cycle. So medicinal compliance is important. Someone asked, how does one truly accept living with a chronic yet terminal illness?
Yeah, you truly do it over time. It's gradual, right? It's not something that happens overnight. This is not just like chronic illness is good. By nature, you have to constantly adapt to it every day, right? It forces you to, you don't have a choice, right? In some ways, right? That, like you said, like one day you can be okay and the next day your body's like, I'm going to give out and you're going to fall, right? And it just forces you to just in a way adapt to what it is. And that's what we talk about in acceptance. Is it's not accepting only the confines, just accepting like, hey, today's the day that where my body's not with me, right? And this is what the limitations are. I accept that today. And this is what I accept about it the next day, right? And living is like, this is what the reality is. And then how do I adjust myself to with this, my reality, instead of thinking that I should be able to do all these things. I should be able to do, that putting all this pressure on yourself that you should be able, that you should be doing, performing at this level, right? The goal is just accepting, shifting with what the chronic illness is doing and being adaptive.
Okay, thank you. This person I really relate to because this has literally happened to me. My anxiety has impacted my work. I have a very stressful job to begin with. I shared my polymyositis diagnosis with my manager, who immediately replaced me with another project manager. I have shared that I've started counseling last week. Now my self-confidence is low, even though I've been a successful project manager for over 25 years. Is this a common reaction, low self-worth? So yeah, answer that question, but if you can also talk about how anxiety can compound. That's what happened to me, in that I'd make a mistake and then I would have more mistakes due to the fear of making mistakes, which, may not be what this person is going through. They're really struggling with low self-worth. So go ahead.
Rachel, absolutely. First of all, thank you for sharing this. This is what a very like heartbreaking, devastating situation, right? And I think a lot of people can relate to this, right? That it starts off with like you being vulnerable with someone and they respond in a very unhelpful manner, right? So of course, you're already scared to share something like that of, that, hey, if I share this something, it may have a negative impact. And that comes true. Right. And in some ways, of course, that's going to continue to increase your anxiety, impact your self-esteem. And that's what anxiety does. As Rachel said, it compounds itself. It's not just one thought, right? It's like a spiral of so many thoughts. So many people will say, like, when you get anxious, you get so overwhelmed, you don't know where to start, right? And then you avoid doing things because you don't know where to start. And then things keep piling up, and then you feel like you don't have the ability to do anything, right? So, and then it starts, then goes a negative spiral, like, see, you're useless, you can't handle anything. So yeah, what you're going through is a very, very real experience, like a lot of people with anxiety have, right? That's why anxiety is just not, oh, I'm just scared of something. Anxiety is a debilitating illness, right? It can really impact people's day-to-day, and starts from day-to-day to impact their overall long-term functioning across so many aspects of their life.
Yes, and I would like to continue with questions, so we might go for another 30 minutes. Dr. Sharma, is that fine?
I would have to hop off because I have patients today, but I am happy to, if you have questions today, I'm happy to basically, like, if you want to send them, I'm happy to give like a written response.
Oh, that's
Yeah.
wonderful. Thank you
Yeah.
so much. Okay, well, I will do that with all
Yeah.
the ones that we haven't done.
Okay.
I'm gonna still answer or give you a couple of more, or
Yeah,
just
yeah.
maybe one more. The person who wrote about gaslighting, if you could give me more information on that so I can give that to Dr. Sharma. One of the things I just wanted to speak to that man about, and everybody, is when you're dealing with low self-esteem or anything, is the self-love piece that I didn't understand. It's the giving yourself compassion. You sound very, you have been successful, and so you're probably
Yeah.
very proud of your body of work, and it's hard when you can't perform to the same standard that you keep for yourself. But can you talk a little bit about compassion or any other self-love things to help you accept your reality and lessen your anxiety?
Yeah, absolutely. I think, Rachel, you hit the note, right? Like, compassion is so necessary because anxiety and depression robs people of that for themselves, right? It just wears them down. Like you said, if you're used to doing something so well and being so efficient, and all of a sudden you lose that, right? And only thing, anxiety will make you focus on what you have lost versus all the things that you have accomplished, right? And that's the part of like compassion that we talk about, is starting with compassion and just in a very small day-to-day things, like things that you are doing well. Like with self-esteem and compassion, think of it, we think of it as a skill that we have to build up, right? Some people are born with confidence innately, but some people have to build it up through practices. And that's how we fight back anxiety, right? Fight back and is by being really learning how to be kind to ourselves, giving us that grace and giving us that space, like being able to say, hey, it's okay, this happened, and making that a flexible thought. Instead of being like, this is what happens and that's it, I can never feel better, being able to say, it's okay, this happened, let's see what I can do differently, right? That what this situation happened with me doesn't define my life, doesn't define what I have been able to accomplish so far. This is a difficult a chapter of my life I'm going through, but that's what it is. It's a chapter. Doesn't have to be my full experience and what it's going to lie ahead.
Okay, let's see. We will do one more and then we will wrap up.
Okay.
Let's see. Oh, someone wanted to know about finding out about more webinars or support groups. The calendar is on myositis.org, and at the top, if Linda would put in the link, but you see the word calendar and click on it, and it will tell you everything that's happening. And you also can jump on any support call that's on. It doesn't matter if it's an Iowa support group and you live in Kentucky. We're a very inclusive community and we want you to get the support you need. So jump on there. And again, the full list of support affinity groups is in the chat. Let me give just one more question. I feel like stress is making my muscle weakness progress faster. Is there a chemical reaction or something else occurring with anxiety that can do that to the body? Again, I know you're not a medical doctor, but I thought perhaps you can talk about stress's effect on the body.
Absolutely. So one thing I do like to caveat, when I work with people with chronic illness, I work with their medical providers just to know like what the confines are, like figuring out, hey, is this a medical, is this an anxiety overlap, just to rule things out, right? But muscle fatigue is definitely one of the things that most people talk about when they are experiencing anxiety, which makes sense, right? Because think about it, when we have an anxious reaction, the fight or flight reaction, even if it's on chronic level, right, that our muscles are constantly tensing up and contracting, and it becomes such a norm that we don't even realize it, right? That we probably are more tense. And so a lot of times when I work with people, I really help them practice progressive muscle relaxation, which involves a process of doing a body scan, and we go through all the big muscle movement, big muscles and small muscles. We practice like tensing them and relaxing them, and then helping them notice the difference. But in a nutshell, the answer is yes, anxiety can definitely increase like the muscle fatigue and all those, because it's a full body experience. It's not just always in our brain, right? It literally leads to like physical responses.
Thank you so much for being here. We really appreciate it so much. There will be a survey. I put the link in the chat, but it'll also pop up automatically when we close. But talking about adding or leaving on a high note, do you have any final words of encouragement to our audience?
Yeah, I want you to first know obviously, I think with TMA, that's one of the greatest things has been, like, it's not a sense of loneliness, being able to connect with people who are going similar experiences to you. And it's similar with anxiety, to know that you're not alone. That's the thing, anxiety, depression, it has a really good way of tricking us in thinking that we are alone and we're going through this by ourselves. But reality is that people are out there who are going through the same experience as you. And just being able to connect with other people and talk with them through their experiences. And I think just realize that anxiety, all the things with anxiety is that it tells you a lot of lies. When you start getting stuck in that cycle, the best thing you can do for yourself is rely on others to help you break the cycle, because they can help you get through it. You don't have to go through this by yourself.
Well, thank you so much, Dr. Sharma. That was amazing. And I will be sending out a PDF of the slides and a follow-up email so you guys can look at that. And it will include the links in the chat, or the links will be active in the PDF of the slides. So also, there is an Ask the Doc, or it's now called Ask the Expert, tomorrow. Linda put the registration link in the chat for that. And you can also find it on the calendar on our website. So thank you everyone for coming, and enjoy the rest of your day wherever you are.
Thank you again for having me, Rachel. Thank you. This was wonderful. And like I said, if there are any leftover questions, please feel free to send them my way.
I will. I'm going to, if your question didn't get answered, I will be submitting it for a written response. So give her a week or two to get back on it, because you're very busy, but we do appreciate you giving that time. All
Okay.
right.
Thank
Thank
you.
Bye-bye.
Take care. Bye.